Hey, my name is Dr. Sean Price, clinical coordinator here at Chiro Spa in Fort Walton. And a lot of the patients that come in to see us, whether they're coming in for traditional chiropractic care or chronic condition care, such as thyroid disease or chronic fatigue syndrome, fibromyalgia, diabetes, irritable bowel syndrome, Crohn's disease, all these different conditions. They come in to see us, and of course they're looking for us to help them increase the functional capacity of their body so that their body can heal itself. And that's what we absolutely love doing in our office. A lot of times we'll have patients that come in with these conditions, and many of them suffer from acid reflux and from GERD. And the common treatment for that is going to be your proton pump inhibitors, your Prilosec, your Nexiums, or your Tums. And sometimes those actually are not the best options for you when you have a situation like this. For example, a lot of times GERD or acid reflux can be caused by too little stomach acid. Now, what do I mean by that? Well, hydrochloric acid is in the stomach, and the food comes into the stomach, goes in the stomach, and the hydrochloric acid in the stomach starts to break down that food. And that carries out a couple of functions. Number one, it breaks down the food and makes it more easily digestible as it continues down through the rest of the digestive tract. But it also kills the bugs and the bacteria that come in with the food, so it's kind of a sterilizing effect on the body as well. When you have too little stomach acid, the food does not process properly. Number one, that you don't have that sterilizing effect to the level that you do when there is enough hydrochloric acid. But also, the food doesn't move through the stomach as quickly as it should because it's not digesting as quickly. So it actually stays in the stomach for a little bit longer, and it can start to ferment. So if the food's sitting in here longer than it should, it'll start to ferment. And then the combination of that fermentation along with what little stomach acid you do have can sometimes creep back up into the esophagus and give you that heartburn effect. Then you take your proton pump inhibitor that neutralizes those gases and you feel better, but the problem with that is you're actually decreasing overall stomach acid production and could be making the problem worse. So it's really important that you determine, number one, do you have too much stomach acid, hyperchlorhydria, or too little stomach acid, hypochlorhydria. And once you've determined that, then you determine what the best way to manage that is, and through which kind of supplementation or medication is the best way to manage that. So I hope this makes sense. If you have any questions, please feel free to post below.